Good afternoon. This is Dr. Brant Lipscomb from UT Physicians, Memorial Hermann in the Woodlands. I am an orthopedic sports medicine specialist who trained at Vanderbilt University and did a sports medicine fellowship at Baylor College of Medicine. My topic today is a very interesting one, particularly in line of what I do. We are going to talk about ACL or anterior cruciate ligament injuries in female athletes. As most of you know, participation by women or young ladies in athletics was not significant until after 1972, when Title IX was legislated. And what became interesting about that piece of legislation was that the law basically said that if I had 5 boys teams, I had to have 5 girls teams. And that really has caused an exponential increase in women's participation in both high school and college athletics. As you see, there's 10 times the increase in high school women's athletes, and 5 times college athletes. So with this vast participation increase in athletics among women, we have noted, particularly over the last 15 years, an exponential rise in anterior cruciate ligament injuries. So let's define what an anterior cruciate ligament is, or ACL. There are really 4 major ligaments in the knee, and the anterior cruciate ligament is the most commonly torn. The ligament really helps restrain the tibia here, or shin bone, from moving forward on the femur or thigh bone, so that what you commonly remember with Gerald Ford having a trick knee, that is what you hear about with people that have a chronic or a long-standing anterior cruciate ligament injury, is that the knee is very unstable. So with women participation going up, skyrocketing, we have had a large increase in women's anterior cruciate ligament tears. This next view shows the anterior cruciate ligament in a better visual point, so that you can see that in the view to the right here, when you have a twisting type injury, the anterior cruciate ligament can tear, and it doesn't necessarily have to be contact injury. Particularly in the women, 70% of their tears are really non-contact, or what we would call deceleration type injuries, where you have either slowed down and changed direction or have made a rapid cut, so that these injuries are generally seen more in terms of cutting type sports as opposed to just running. So sort of epidemiologically speaking, or statistically speaking, if you look at high school sports, let's say, and you compare ACL tear rates in women's high school sports versus male, a young lady or woman is more likely 2 to 8 times to suffer an ACL tear. So you can see the next point here, where the women will sustain about 38,000 ACL tears. And what's interesting about that statistic is in these times of high cost care, health care costs, an ACL tear, if it's reconstructed, generally runs somewhere in the neighborhood of $25,000 per ACL tear in reconstruction, which is a significant, obviously, amount of money. So these pictures are arthroscopic pictures. So those of you who understand arthroscopy, or have had an arthroscope procedure, you know they make 2 or 3 small incisions, and the arthroscope is actually sort of a lighted pencil with a fiber optic cable translating the image to a sort of a TV screen. And on the left here, you see the intact ACL, and over here on the right, you see the ACL tears. Now, what's important about that is that as opposed to a ligament on the inside or outside of the knee, which is outside the joint, many times those ligaments will heal on their own with just rest and therapy. When the ACL tears, as you can see, it actually tears like what I call a twisted rope, so that the fibers actually, they don't tear like when you cut yourself shaving. They tear like a bundle of rope. And the problem with this is that once you tear your ACL, it does not have the capacity to heal itself. And that's when we get into the reconstructive procedures for the ACL in order to restore the stability of the knee. So, ACL injuries, particularly in women's sports, are common, as we discussed, in the cutting type sports: basketball, soccer, volleyball. We discussed that they're 2 times more likely to suffer from ACL tears than their male counterparts. In other sports, people would say 2 to 8 times, but it really depends on the sport. In soccer players, 4 times more likely to suffer from ACLs than a man who plays soccer. This is a picture. If you look on the internet, it really, to me, represents visually the problems that we're going to discuss here in a minute about why the women have a more or a higher frequency of tearing their ACL. This is a lady, Rebecca Lobo. Some of you might have remembered her as in the first generation of professional basketball players. She, in this picture, shows a common mechanism of how women tear their ACLs. As you can see down her left leg, it's relatively extended as opposed to bent like the right knee here. And then as she comes down with the rebound, her weight tends to stay slightly to the right, but the trunk tends to go to the right, and the left foot is planted, and therefore you can see this extreme force that's placed on her knee here. And unfortunately, I believe this lady actually tore this left knee 3 times, even after reconstructions, which actually I think sort of caused her to have to retire from women's professional basketball. So this is sort of the idea on this schematic here, whereby we've gone back to our ACL picture. We have sort of the rotation here of the knee, and we have tears of the ACL where it's a complete tear, like I showed you in the previous slide. Sometimes we have partial tears, and those are interesting to discuss. And then in the younger sort of pre-adolescence, we can actually tear bone off with the ACL. And in each of these 3 clinical instances requires sort of a different treatment plan. Now, for the next part of our discussion, I want to discuss certain causes of ACL tears, particularly in women. And there's certain causes that you can't change. It's sort of like what you're born with or what you have. One of the things we've noticed in women is they have what we would call a tight intercondylar notch. This gives a really good picture of a knee with the ACL being here. And then you have this thought of where the ACL lives. What I tell people, it's kind of like the ACL's home. And the ACL runs from here all the way back up into the femur here, this being the outside of the knee over here, this being the inside. So what goes on here is that the ACL is in a tight home, and we call this a tight notch. So where the ACL lives is sort of roof over the ACL, is sort of like the roof over your house, but it's where the ACL lives. And in many instances, this is a very tight notch. And what goes on is that when the ACL stretches, it tends to not have a lot of room to change its position. And some people think this is one reason why the ACL tears more frequently in women because they tend to have a tighter notch than the men. People, as you know, women are much more likely, and you just go to a high school football game and watch the cheerleaders, they can do the splits, and you don't see guys doing a lot of splits in the men cheerleaders, and so they tend to be looser, and because their joints are just naturally looser, they're more susceptible to possibly tearing their ACL. Now, this is a picture, an x-ray rather, of a knee from the outside. We're looking at the outside of the knee, or what we call a lateral view, looking from as you were standing away from the knee. So a side view, if you would. This is the femur we talked about, patella, tibia, fibula. And there's probably one of the most popular theories has to do with the tibia and the outside of the tibia. The inside of the tibia tends to be concave. The outside tends to be convex. And there's this thought that as the tibia goes forward, which is restrained by the ACL, which would be here, by the slope, or the way this lateral tibial plateau or outside of the tibia is made, it tends to want to tear more frequently if the slope is greater. And that seems to be the situation in a lot of women. There's been a lot of research done on the estrogen progesterone cycle in women. There was a lot of thought that in the pre-ovulation phase of a woman's monthly cycle, that the changes in the hormones, particularly the estrogen surge, can cause the ligaments actually to get looser. That theory is not as popular as it was maybe about 10 years ago. The other thing that we notice is, and this is very common when we get to the next section on the modifiable ACL tear factors, is as women go through puberty, their pelvis widens, and as you know, girls grow much more rapidly than guys do. They tend to go through their growth cycle, at age 11 to 12. Some guys start at 13, 14. And a lot of people, as you would commonly say, their bones are growing very fast, which in reality has a lot to do with what we'll talk about as to why they tear their ACLs, in that the pelvis widens, which changes the shape of the position of the legs and can make them more susceptible to ACL tears. Okay, so let's talk about modifiable risk factors, which is really a lot of the intent of this talk. Really the four things that I'd like to talk about are what we would call ligament dominance, quadriceps dominance, leg dominance, and trunk dominance. Now this schematic or figure on the right here, it looks a lot like Rebecca Lobo's picture that we went over before. In that you can see in the woman the pelvis is wider. That tends to make the knee what we used to call more knock-kneed, as you all remember that, where the femur, by the shape of the pelvis, tends to cause the leg to bow out this way. And so let's say this lady or this schematic came down with that rebound, that foot plants, like the picture we showed of the pro player. They put a force here on the inside and they rotate their pelvis. Now, one of the things that is very common is that when women land from a jump, they tend to land very straight-legged, and that's called sort of the ligament dominant knee, whereby the force when you land is putting more stress on your ligaments than if you land sort of in a crouched or a bent knee position. The other part of this is that women tend to have more quadriceps dominant versus hamstring, so that the quadriceps, when you land, tends to pull the tibia forward. The hamstring behind the leg holds the tibia back, and by being quadricep dominant, they tend to pull the tibia forward, which can cause the ACL to tear. Many women also tend to be very right-legged as a right-handed person, and therefore tend to put more stress on their dominant side, and this is something that's been seen as very different between guys versus women. The other thing that we notice is that when they land stiff-legged, they tend to they don't have good trunk control. And part of what we're trying to teach is as the girls go through their maturation phase and they tend to get a wider pelvis, and coincidentally, that generally is when they start playing a lot more sports, you see. So you have this sort of, it's kind of like what I guess people would call a perfect storm. Their body is tending to make them more susceptible to ACL tears. And then, as you know, with all the select sports going on these days, that's when they start playing a lot more sports. So these 4 factors really are what the basis of a program that we are interested in implementing to try to prevent the ACL tear. So there's that picture that we just went over. Sort of, I wanted to re-emphasize that, and this really kind of shows the schematic. See, that foot is planted and externally rotated. She tends to be knock-kneed in the position of the knee. Her trunk, you know, she doesn't come down like a real good jump. It's very stiff-legged. I don't mean to be critical about this, but something that keeps popping in my brain is that these people that are like this, they're very much like a giraffe. They're very stiff-legged. They don't have a lot of flexibility in their landing, and that's something that when I think about these people and how they're landing, it's very different than what a lot of the guys are doing. Okay, so what are we trying to do? So we've just discussed that as the girls are going into their maturation phase and are playing more sports, they tend to land incorrectly. And so what we've been doing, and this has been going on for about the last 10 years, is we are trying to re-educate the girls or women into how to, jump and land so that their landing will, it'll make them land more with a bent knee, which will take away the ligament dominance. B, we would like the quads to be less dominant, so the hamstrings hold the tibia back. C, we jump on both legs to try to get rid of the one-legged dominance. And D would start landing with the appropriate trunk control. Now what's interesting about this picture is you see this ACL brace, and this is her trainer showing her how to land better. And the idea being, like, if you tear your one ACL, you've got a 10% chance you're going to tear your other ACL. So there's a lot of things that kind of add up here. So the basis of these programs is really to change the way these ladies are landing so that we don't get to this point where they tear their ACL. So as you can imagine, this landing and changing direction has nothing to do with anybody coming as far as contact. It has to do with the way they land and pivot and turn, which is what these preventative programs are all about. So this slide basically says we're going to try to improve the ability to land from a jump and change position. So this picture here is a balance board so that you're trying to get this knock-kneed position to be more straight. Obviously, part of this program is one-legged jumping, so you try to learn how to jump more appropriately. So the goal, and this has been shown, we'll talk a little bit more about this, is that if we institute these programs, the data would suggest that we can decrease their risk of an ACL tear to about the same level as a man. And this is, to me, is extremely important. I mean, I know people that are listening know someone who has torn their ACL, maybe they've torn their ACL, and the amount of rehabilitation, cost, psychological difficulty, just getting over an injury of this degree, it's a lot. So, this is our goal, is to try to get programs in place so that we won't tear our ACLs as much likely. So what are the parts of this? We talked about the Q angle over here. We've sort of mentioned that. That really has to do with the concept of the knock-kneed, so that, as you see here, the leg is straight, and here we've got this sort of knock-kneed or outward bow. This is that wrong position where we land with the leg out. This is where we land more appropriately. This is where we're training the athlete how to land appropriately. So plyometrics has to do, as you know, with jumping from elevated objects. So that's part of this program to prevent ACL tears, is you try to get these ladies or young women to land from a jump appropriately. And then the biomechanical analysis is like this. We don't want them to land like that. We want them to land more bow-legged as opposed to knock-kneed. So the biomechanical analysis has to do with more in tune. It's in tune with, like, well, let's see how you land from a jump, and what leg is more dominant. So you have a screening where you try to see which women are more susceptible to an ACL and which ones have better landing patterns. Okay, now this is sort of in summation, but this is why I'm sort of very passionate about this subject. This is an interesting point, and I don't think most people appreciate this, that if I tear my ACL today and I either get a reconstruction or don't, about 10 to 15% of these people are going to get arthritis or wearing of the surface of the joint. Why is that? It's because most of these injuries not only tear the ACL, but they injure the surface of the bone, and it's in the MRIs we do today, they're called bone bruises. And regardless of whether I reconstruct your knee or not, you're going to get some wear secondary to that significant wear, that injury to the bone when you tore your ACL. So another point that's critical for those of you who have had an ACL reconstruction: when you participate in your therapy after your operation, you have got to correct the problem with your biomechanics that caused you to have the ACL tear in the first place. Because what people, it happens is that you don't want to tear your operation up. It does happen. But the more we can do to change your biomechanics as far as landing and cutting, the better chance we'll have of not tearing the operation up, or, as I mentioned, the 10% chance of tearing the ACL in the opposite knee. So, about myself, I am in the Woodlands, across from Memorial Hermann, the Woodlands, in the 9305 Pinecroft building, Suite 400. There's my information. So what I'm trying to do is I would really like to see the programs that are set up that have to do with neuromuscular training on ACL tears be implemented in our high schools, so that people will have less of a chance of tearing their ACL. Other things about what we have done here at 9305 Pinecroft: we just opened up our third Memorial Hermann Ironman Sports Medicine Institute. The two others are in the Med Center in downtown Houston. The other is at Memorial City. I'm the medical director here, and part of my mission as medical director will be to try to, and it's sort of an interesting concept, when you want to implement programs to stop ACL tears, particularly among women, it has to be, I hate to use a phrase, but the coaches and the trainers have to buy into the fact that we're going to do this, and by being compliant with the program, we have a better chance of preventing an ACL tear. But you have to sort of have the coaches and trainers buy into the fact that they're going to do the program. And there are about 2 or 3 out there right now that are most popular. But the point is, and I think every coach or every parent who follows any sports always knows of a girl on either the basketball, soccer, or volleyball team who tore her ACL. Sadly, many times they're the best player, and therefore, from a coach's perspective, you certainly want to have your best player. And my sort of rationale behind this is, if I could possibly do something to decrease the chance of our players tearing their ACL, I will change my warm-up. I will change my conditioning, because if you've done that and they've torn their ACL anyway, then I don't think you would feel as bad about this. But I feel at this point in time, we have to do a better job of educating our coaches and trainers about trying to implement these neuromuscular programs to prevent ACL tears, because as we see, even though you can reconstruct an ACL and get them back to playing, the reconstruction is nowhere as good as their native ACL. I mean, you can get 90% to 95% good results, but as I said, you can get arthritis as well, and you don't really have any control over that. So any questions you might have, I'd be interested in discussing them. I have one question here about recovery or therapy after reconstruction. That's a good question, and I'll make it sort of broad guidelines. This is kind of an interesting topic because, in my experience, everybody's recovery from an ACL can be a little different. I mean, people would like to say we're all the same, but anatomically and how the body recovers after reconstruction is very individual. But for broad guidelines, we say that most people are on crutches for 2 or 3 weeks after the reconstruction. Most people start jogging a little bit at 3 months. Some people get back to their sport, and I emphasize some people get back to their sport at 6 months. But if you really talk to athletes who have had their ACL reconstructed, they really don't feel like they were back to their full capability until about 9 months to a year. The real science behind ACL reconstructions would say that your ACL reconstruction graft is not where it needs to be until about a year after the reconstruction. So one of the things that really is very disheartening or makes you upset is if an athlete goes back at 5 to 6 months after their reconstruction, let's say plays football, and tears their ACL reconstruction, that is not a happy athlete or family. So I hope that answers that question. The next question has to do with, does being overweight increase your chance of having an ACL injury? It's a good question. In my opinion, that I haven't seen any data on weight and ACL injury, but I will tell you this. Many people that are overweight are deconditioned. Their muscles are not in very good shape. And as we went through in the discussion earlier, your overall, which is really kind of the point of this talk, your overall conditioning and how you respond to landing and turning determines in many instances where you have a chance of tearing or not tearing your ACL. So sort of logically speaking, if you're overweight and you go out and let's say play soccer and you haven't been working out, I would, and it's not been proven, but I would suspect that your chance would be higher of tearing your ACL, particularly if you're playing a very competitive sport. I hope that answered that for you. my next question about stretching before exercising and playing sports. Part of the ACL prevention program is for preventing an ACL tear. Part of that program does include stretching, and the drills, if you look through the ACL prevention programs, the drills include stretching, some jumping, agility drills where you change direction. So stretching is part of that ACL prevention program. I want to thank you all for joining me today on this talk about prevention of ACL tears. I've enjoyed the opportunity to speak about this topic. I think it is really important, particularly as we go along and try to prevent an injury which can be devastating to an athlete's career. Thanks a lot. Bye-bye.